Hello, this is Kim McAllister, and now we're moving on to part 3 of chapter 26, where we discuss antitussives and expectorants. These medications are used with coughs and with chest congestion. So respiratory secretions and foreign objects are usually responsible for coughing, the cough reflex, and when patients cough, then whatever material is in there will be removed, expectorated by the cough reflex. So the cough reflex is initiated by sensory receptors in the respiratory tract. When those receptors are stretched, then the cough is stimulated. There are two kinds of cough: a productive cough, where you're coughing up secretions. The patient will either swallow the secretions or spit them out. A non-productive cough is that dry cough that people will have, and it serves no therapeutic value. Usually coughing is wanted in order to pull up those secretions and remove them out and to expectorate them from the respiratory tract. It can also be helpful for removing foreign substances, but coughing can be harmful. For example, when someone has a hernia repair or certain types of throat surgery. And also that continual dry cough can lead to respiratory distress and can be very tiring for the patient. It can keep people from sleeping. It can cause issues. So antitussives are the class of drugs that are used to stop or reduce coughing. They are classified as either opioid or non-opioid, and they are used only for productive coughs. And the only time they're not used for a productive cough is, as we said, when coughing, that dry cough can be harmful. So the opioid class will directly suppress the cough reflex by suppressing the cough center in the medulla. It also has an analgesic effect, and it will dry out the mucosa of the respiratory tract, and it causes increased viscosity of the secretions. Examples of opioids that are used for antitussives are codeine and hydrocodone. Generally, the dosages and the amount of time that this is given is not enough to cause dependency, and they're very effective. The non-opioid medications that are given as antitussives are dextromethorphan. It works in the same way by depressing the cough center in the medulla. It's not quite as effective as opioids, and it can be purchased over the counter. Patients should be cautioned that sometimes they're sold in combination with other cold remedies, so it may have a combination of ephedrine or other medication mixed in with it, and so they need to be careful to look at what they're getting. It has no analgesic property, and it does not cause any CNS depression like the opioids do. Another opioid is benzonatate, which is more commonly known as Tessalon pearls. These are little tiny capsules, and they're rounded, and patients are supposed to swallow them whole. If they crush them or chew them, or they dissolve in the mouth instead of swallowing them, it can be harmful. It can cause numbing to the throat, and so they need to be careful not to eat or drink until that numbing effect wears off. It numbs the stretch receptors in the respiratory tract, and it prevents the reflex stimulation of the medullary cough center. So patients take antitussives when a cough is non-productive or when it's harmful. Contraindications, of course, are drug allergy, and in a case of dextromethorphan, if it's in combination with other medications, allergy to any of the medications in the preparation would be a contraindication of that. If a patient is trying to deal with or is experiencing opioid dependency, then they would not need to be taking an opioid antitussive. The opioids will cause some respiratory depression. Benzonatate can cause dizziness, headache, sedation, nausea, and some other side effects. Again, if they are not swallowed whole, if they're chewed or crushed, it can cause numbness in the throat. Dextromethorphan can cause dizziness and drowsiness, and in some cases can cause nausea. Opioids have the same side effects as they do when they're being taken for pain medication or cough medication. They can cause sedation, vomiting, nausea, lightheadedness, and constipation. So when caring for a patient with a cough, you need to assess that cough, find out if it's productive. If it is, assess what is being produced. Assess the patient for allergies. Instruct the patient to avoid driving or operating heavy equipment or doing anything that's hazardous due to the sedation or drowsiness or dizziness. Report any of the signs and symptoms to the provider. A cough that lasts more than 1 week, that may be an indication of a more serious problem and may need additional treatment and evaluation. A persistent headache, fever, and rash. Rash can be a sign of an allergy or other adverse reactions. Antitussive drugs are for non-productive coughs, and you want to remember to monitor for therapeutic effects. Expectorants are medications that aid in the removal of mucus. Where antitussives suppress the cough, expectorants encourage the secretions to come out of the respiratory tract. They will reduce the viscosity or the thickness of the secretions, and they will help to thin out the secretions. For example, guaiacin, which is commonly known as Mucinex, is very helpful for this. So drugs can cause irritation of the GI tract, and loosening and thinning of respiratory tract secretions can occur in response to this irritation, and so that can be a reflex. The secretory glands are stimulated directly to increase the production of respiratory tract fluids, and the whole result of this, the result of taking an expectorant, is that a thinner mucus is produced that's easier to remove. So it not only thins secretions, but it helps to loosen them as well so that they come out easier. So by loosening and thinning the sputum and the bronchial secretions, the tendency to cough is indirectly diminished, but it's easier to get more out when a patient does cough. So expectorants are used for relief from a productive cough when a patient has a common cold, bronchitis, laryngitis, pharyngitis, that's the inflammation of the throat. It can be caused by chronic paranasal sinusitis. So patients that are continually producing that mucus, the expectorant will help loosen it and thin it out. Pertussis, also known as whooping cough, influenza, and measles. Expectorants need to be used with caution in older adults and patients with asthma and respiratory insufficiency. Patients taking expectorants should receive more fluids to help loosen and liquefy secretions. So reminding patients to drink plenty of fluids, 8 to 10 glasses a day, unless they have some contraindication like heart failure or renal failure. Then they would not need to do that, but that will help get it out. They need to report fever or a cough lasting longer than a week because they may need additional treatment or evaluation. And as always, you want to monitor for therapeutic effects. Echinacea is a herbal product that is commonly used for reducing problems with common cold, and it improves recovery time. It can cause some mild side effects such as dermatitis, some irritation, GI disturbance, dizziness, and headache. And patients always need to be told to notify their provider of any herbal or supplements that they're taking. Thank you very much. That concludes Chapter 26.